Hi everyone, my name's Karen and I work for the Eve Appeal, the UK's gynaecological cancer research charity. Now it's Ovarian Cancer Awareness Month and I'm making a series of videos with the wonderful Dr. Ellie Cannon. She's a GP and wonderful ambassador for the Eve Appeal, and this video we're going to be talking about the hereditary link with ovarian cancer. Let's just ask, can ovarian cancer be hereditary?
So most ovarian cancers are actually what we call spontaneous, so they are not ones that are running in a family. But around 15 to 20% are considered to be genetic or hereditary, i.e. you have a gene or a genetic mutation that makes you much more at risk. Now mostly that will be with what we call BRCA. So that's a genetic mutation that gives you an increased risk of ovarian cancer as well as some other cancers. But there are also other genetic mutations that we know about that we may not know so much about yet. Things like Lynch syndrome and other genetic problems that can also increase your risk.
But BRCA, the BRCA gene mutation, is the most common gene mutation that can cause an ovarian cancer.
Well, it's the one that we know most about, so that's the one that's associated also with breast cancer and with some prostate cancers, and bowel cancer actually as well. So we know a lot about BRCA and we are able to test for BRCA, I suppose, more easily than the other genetic mutations. This whole area of genetic mutations and those risks of ovarian cancer really is something that's evolving and growing all the time in terms of cancer research. It's something that we're learning more and more about each day.
And how does someone know if they carry the BRCA gene mutation?
A BRCA gene mutation will affect 1 in 400 people within the general population. There are certain populations who are more likely to have BRCA genes within them. So for example, in the Ashkenazi Jewish population, 1 in 40 people.
Well, that's a huge difference.
Yeah,
isn't it?
so that's a much bigger difference. So we'll have that BRCA gene mutation. So if you're in one of those populations, then it's more likely. If there are clusters of cancer within your family, then it's something you should be thinking about. So ovarian cancer, but also breast cancer, bowel and prostate. If there are clusters within your family history, whether that's your parents or aunties or uncles or cousins, then that is certainly something that should be thought about.
If someone's nan and aunt have had ovarian cancer, is that person going to be more at risk?
So a grandmother is what's called a second degree relative. That's 2 away from you, as is an auntie, 2 away from you. So that's 2 second degree relatives. But I would say, in terms of stratifying that sort of with risk, that person would have to go to the GP and go through all of the family history. Because in order to get genetic testing, you have to sort of tick certain boxes and have a certain number of relatives. But what might be important there is not just the ovarian cancer, but have there also been other cancers? Has there been colorectal? Has there been breast? Has there been other things? So that definitely warrants a discussion and possibly even a referral.
And would the age of the nan and aunt when they got the ovarian cancer kind of play a factor? Like, does it kind of ring more alarm bells for a GP if the aunt was 30 when she got ovarian cancer?
Yeah, it does, because they're those sort of younger aggressive cancers that are often associated with genetic mutations. So I would say if you do know the age of diagnosis, that's really important. And knowing, as I say, the other sort of family history. And don't forget the men. It's also important.
Yeah.
Men carry genetic mutations and pass them on to their
And
daughters.
men can have breast cancer, which
They
I think
can,
people forget as well.
but also men can give their daughters a BRCA mutation and other genetic mutations. So it's important to really look at the whole family history and the whole family tree.
Can a GP give somebody a BRCA test? Is that something you can do?
Yeah, so we can request it, but we don't actually do it like the other more simple blood tests that you would do in practice. It is a blood test. We refer for BRCA and gene testing because you have to be referred to a genetics team for that. Because anybody who has genetics testing also has to be linked in with a genetics counsellor, because that can be obviously a huge deal to be diagnosed with any form of genetic mutation, whether we're talking about cancer or other illnesses. There are usually certain criteria to fulfill in order to get that testing. So whether you're from a high risk population or, as we've talked about, you've got the sort of very sort of obvious familial cluster, but it's certainly something that your GP should be able to refer you to.
But not actually done at the GP practice itself.
No, it's not done at the GP practice, and also I think it's important for people to realise it's not a quick thing. So it is something that you are referred for on the NHS. It's subject to waiting times like other things, so it would be months rather than weeks.
So you're not going to get a quick answer if you're worried?
It's not going to be a quick answer. It's going to be a good sort of couple of months, depending on where you live and what the access is like to get that testing.
So once someone has found out that they carry the BRCA mutation, what happens then? Like, what do you do with that information?
So if you're found to have a BRCA genetic mutation, obviously that is a very big diagnosis, because that is giving you much increased risk of ovarian cancer as well as other cancers, and also the possibility of then passing those genes on to your children. So this is a huge discussion for people. You would be looked after by a consultant within the hospital who would be talking to you about what we call risk reduction. So measures in order to reduce your risks of developing those cancers. So,
and is that surgery or?
So absolutely. Yeah. So that is the surgery that sort of is sometimes talked about within the media. So people that we will have heard about who will have had a double mastectomy or will have had their ovaries removed, what's called an oophorectomy, in order to get rid of their risks, basically. But obviously that's a discussion that is huge.
Yeah. It's a massive deal, isn't
that's
it?
a massive deal.
And or ovaries removed.
You know, if you have your ovaries removed, you are then straight into a very sudden menopause. So that's a very, very big discussion. Obviously, that has massive implications for your fertility and when you're going to have children, and if you're going to have children even. So that is a huge discussion.
So say I found out that I've got the BRCA mutation, I've had risk-reducing surgery, and I've got a son and a daughter. What happens for them or to them?
Okay, so they would definitely need to be tested, both of them, because the chances of passing it on would be 1 in 2.
So it's 50-50?
Yeah, so it's very, very, very sort of high chance. So they would definitely need to be tested, and both men and women need to be tested, because obviously if a man is carrying a BRCA gene mutation, first of all, that can confer some risk to them. So there are some prostate cancers that are associated with BRCA, but also they're then passing their BRCA gene on to any daughters that they have. So they both would need testing for sure.